We knew the winter health crisis was bad. ITV News witnessed the pressures firsthand at hospitals across the country. But today, new figures show just how bad. NHS trusts in England are hugely in deficit, double the amount they themselves predicted. Northumbria Hospital's finances were revealed to be healthy today, but nonetheless, they say demand has been very high.
It has been a difficult winter. We had big problems with norovirus and influenza, for example. So patients are coming in more complex than they ever have been. And if you're a system under pressure, that just makes it harder. You're asking more of your staff, you're asking more of your equipment, you're asking more of your patients than ever before. That is difficult.
NHS trusts in England ended the financial year with a deficit of close to £1 billion for acute services like accident and emergency. That's almost twice the £496 million they'd planned for. The black hole comes as today's figures reveal nearly 5.9 million people went to A&E in the first 3 months of this year, 220,000 more than the same period last year. At a time of unprecedented demand, hospital bosses say their staff are holding things together in extremely difficult conditions.
We've seen such a lack of investment in buildings and equipment over the recent years that staff have done a heroic job keeping the services going, despite the fact they've got some of the oldest kit I've ever seen.
We expect the NHS to get new money in the summer. The question is, how much? The Chancellor of the Exchequer accepts that the NHS needs fresh cash, but he doesn't want to give them everything they want. If he gets his way, then experts believe the kind of financial problems laid bare today won't completely go away. And that's especially true when experts believe the size of today's deficit is not £1 billion, but much larger.
We believe that the real gap between the amount that NHS trusts are getting and that they've had to spend on delivering care for patients is probably as large as £4 billion. Now that's being papered over by a huge range of things, from raiding money that was meant to be used for transforming the NHS to one-off savings that can't be repeated. But the important thing is that that gap will emerge again as hospitals enter next year.
The government is going to come up with a new funding settlement for the NHS. But these figures today show that for many hospitals, that new money can't come soon enough. Allegra Stratton, ITV News.